Right back on the Newsfeed PM. The South African Health Products Regulatory Authority is warning against some supplements for children containing zinc, picolinate and selenium. SAHPRA says these products may pose health dangers such as indigestion, diarrhoea, headaches and nausea and vomiting to children under the ages of 18. The public has been urged to return the products. For more on the story, I'm now joined by Tammy, Gopal, who is SAHPRA's Chief Regulatory Officer. Tammy, good to have you, and thank you very much for your time. You say SAHPRA has been aware of these products in the market. How long have these products been in the market, and in what form do they come?
Thank you very much, Thabo, for inviting SAHPRA to Newzroom Afrika. Some of these products have been on the market for more than 10 years at least, but it must be noted that complementary medicines are not yet registered by the regulator. We will be registering products maybe early 2027. So these products have been on the market. We have communicated to the industry via our guideline in 2020 that zinc, picolinate and selenium, when it is found as a health supplement in complementary medicines, should not be administered to children under 18 years of age.
Draw that distinction for us. What are complementary medicines?
Thank you for that question. They're actually an ambit of medicines. Complementary medicines are category D medicines. They have a particular discipline, for example, Chinese, Ayurvedic, and even health supplements that fall under these types of complementary medicines. They are different from what we call allopathic medicines or category A medicines that go through a different review process through SAHPRA.
So what are the requirements for those who sell these complementary medicines? Are they medicines available readily over the counter? Is there a particular protocol or regime that they must follow before they sell these?
Yes, these manufacturers should be licensed by SAHPRA. By now, they should have received an import-export license to distribute the product within the country. And SAHPRA will then undertake a registration of each product, as I said, early next year, once we finalize our regulations with the Department of Health, which is under a discussion at the moment. So secondly, apart from the license, there are guidance documents that SAHPRA has issued. These are the guidelines that we have available on our website that gives applicants an understanding and an ambit or a framework of what their products should comply with. When it comes to this particular zinc, picolinate, selenium, other minerals, they are readily available in our guidelines specifically related to safety and efficacy of complementary medicines.
Zinc, picolinate in itself and selenium, are they dangerous substances? Are they dangerous products? Or is it the fact that they are being used in this particular manner and being ingested by children that is the challenge?
So let me answer the question in two ways. When it comes to children, they are not allowed because of the increase in the toxicity. I'd like to just clarify that we're talking about zinc picolinate, and it's important for the public to understand that it is this particular derivative that's under discussion, not zinc acetate, zinc chloride, zinc sulfate. These are allowable in children, and our guidance document does allow for these levels in children. The zinc picolinate, it's a chelating agent, the picolinate specifically, which then allows for an increase in the absorption of the zinc, thereby causing increased side effects that may be unpredictable in children. That's the first point. On the selenium, it has a narrow therapeutic window, which means the toxicity is possible in children. The fact that these products are available from the shelves over the counter, and the fact that a child may be given more than one product without supervision of oversight of a pharmacist is then a concern. So these unpredictable levels in selenium and zinc picolinate in children is what is under discussion and is concerning.
Yeah. And, you know, I'm trying to simplify this for anyone who might get to a pharmacy and pick these up. What are they actually using this medication for, these supplements for? I mean, do you get advised by someone to say, no, this is the product, it will help with what?
So generally, these products have claims such as immune support, assisting with immune system functioning, hair and nail growth, cold and flu support. Those are the types of claims being made on these products, and that's how parents can identify it. Take the product, look at the ingredient listing, identify zinc picolinate, identify selenium, and do not administer it to children under 18 years.
So if you identify the medicine being sold containing such, it's really a warning for you to say, don't purchase this for your child, to be consumed by your child. But there is really no other legal bearing, I suppose, on the pharmacy or whatever shop that would be selling that product to say, I now need to report them for selling this product.
You can. There is a legal bearing. Now that SAHPRA has issued this media communication, it means that we as a regulator have enforced this position. This now means we have allowed the industry 6 months to ensure that these products are taken off the shelves of distribution channels of wholesalers. Secondly, we are allowing that if applicants and manufacturers still want to continue promoting their product for the indication in children, they need to follow the full registration process for these products as a medicine. And if patients are seeing these products on the shelves, they're welcome to contact SAHPRA on our complaints website, sahpra.org.za. The information is available. Thabo, I'd like to also comment that we have a regulatory compliance department in SAHPRA that undertakes investigations and enforcement. So our teams will be visiting pharmacies and the market shortly to start identifying these products and ensuring that they are pulled off the shelves.
Are these products that are manufactured locally, or are they being brought into the country, and therefore there is maybe an obligation elsewhere to monitor their coming in?
Yes, there are two options. They are locally manufactured and fully imported. So our border officials will also get involved on identifying these products. And that's, again, the regulatory compliance team.
Right. You're saying if they want to continue then to distribute these, they will then need to interact and engage with you on a more fuller program of registration. Just for those who might not understand what that means, what would that entail?
That means a full registration, which is a category A submission that applicants are aware of, that would then accompany a dossier or a submission to include clinical data and substantial information to allow the justification of the use of these two ingredients in children based on the claims that the applicant or the manufacturer has. So if there is a claim for immune support, there must be sufficient clinical evidence on immune support and use in children, and again, protection against these toxicity effects.
Yeah, and when they fail that, or depending on whether they're successful or not in that process, it would determine whether then they continue to have the right to distribute.
Absolutely, but until they have a product registered, which does take 3 years or more at this point in time, the product cannot be sold because it is technically a category D, which is a complementary medicine. So they don't have the rights to sell it as a category A medicine.
So in terms of support, you're saying your website is the place to go to and alert you of such. In terms of monitoring yourself, I mean, what are you going to be doing as far as the monitoring to protect public health?
We would like to start engaging with applicants that we are aware of that have these products. We will then have our regulatory compliance team go into the market and look at enforcement. Thirdly, we would really like the public to engage with us when it comes to any complaints on our website, as well as any adverse events that may be experienced by children. Patients could then download the Med Safety app, communicate with SAHPRA using that app. Healthcare professionals could use the Med Safety app on adverse events. We also have a tab for adverse event reporting on the SAHPRA website. So there's quite a few tools available for the public to engage with us. We also have a contact for our complementary medicines unit if pharmacists and healthcare professionals want to engage on a more technical level with our complementary medicines, and generally media queries are through our media department. So there's quite a few avenues to engage with SAHPRA.
Tammy, Gopal, appreciate your time. Thanks so much for coming on. SAHPRA's Chief Regulatory Officer there, issuing a warning on this particular substance. It's not zinc in general, but it's this particular substance called zinc picolinate contained in some of the product, as well as selenium, saying these are not approved in the country to be consumed, particularly